Hi everybody, this is Wendy Lokanc-Diluzio. Welcome to week 3 of Public Health 3000. This presentation will focus on the determinants of health from a Canadian perspective. The objective of this presentation is to understand the population health promotion model and consider how it can be used to address global and Canadian health issues. The population health promotion model is a model that I'm sure you've come across in your other courses. I want to take the time to provide a brief explanation as it is an important model, and I will be asking quiz questions related to this model. The population health promotion model was developed in 1996 by Hamilton and Batty. The overall goal of the model is to improve the health of the population through a comprehensive approach. Population health is an approach that addresses the entire range of factors that determine health, and by doing so affects the health of an entire population. Health promotion is commonly defined as a process for enabling people to take control over and improve their health. Population health promotion explains the relationship between population health and health promotion. It shows how a population health approach can be implemented through action on the full range of health determinants by means of health promotion strategies. Action needs to be taken on the full range of health determinants, which will be discussed in the next several slides. A comprehensive set of action strategies needs to be used to bring about the necessary changes, and action needs to be taken on at various levels of society in order for change to be effective and accomplished. So what makes people healthy? Well, according to the model, the determinants of health do. So these include income and social status, social support networks, education, working conditions, physical environments, biology and genetics, personal health practices and coping skills, healthy child development, health services, gender and culture. Just a couple of notes, gender and culture have been added to Hamilton and Batty's version of the cube. Many of these determinants have interaction effects. So for example, education will impact income and working conditions. You've probably seen in your other courses as well that gender can have an impact on education as well as socioeconomic status. So it's important to consider the interaction effects. Income and social status is an important determinant of health. And it's not the amount of wealth, but its relative distribution, which is a key factor that determines health status. Likewise, social status affects health by determining the degree of control people have over life circumstances and hence their capacity to take action. Evidence from the second report on the health of Canadians showed that only 47% of Canadians in the lowest income bracket rate their health as very good or excellent, compared to 73% of Canadians in the highest income group. Low-income Canadians are more likely to die earlier and to suffer more illnesses than Canadians with higher incomes, regardless of age, sex, race, and place of residence. At each rung of the income ladder, Canadians have less sickness, longer life expectancies, and improved health. In a Canadian study investigating teen parenthood, teen mothers had a greater likelihood of having a lower socioeconomic status compared to their average aged counterparts. And teen motherhood is often associated with incompletion of high school or post-secondary education. With less education, the teen mother may lack job skills, producing poor economic outcomes. And teen mothers are also at risk for single parenthood, which also impacts socioeconomic status. and experiencing poor economic conditions puts teen mothers at risk for depression and anxiety. Additionally, these economic conditions place the children of adolescent mothers at risk for adverse effects on health and wellness. So this again shows intersectionality here, that education and socioeconomic status and social support all have a relationship when it comes to, for example, being a teen parent. Alberta produces primary healthcare community profiles for sub-communities within the province of Alberta. I looked at the teen birth rates, and those are reported per 1,000 population for each sub-community within the Calgary zone. I then looked at the percentage of families considered low income in the sub-community and plotted the numbers against each other. So as you can see, some of the communities that had the highest teen birth rates in 2017 also had higher percentages of families considered to be low income. Here's a similar type of graph. For this graph, I looked at the chlamydia rates in each Calgary subcommunity and plotted the rates against percentage of families considered to be low income. Once again, you can see that the chlamydia rates are higher in some of the communities where there's a higher percentage of low income families. Another important determinant of health is social support networks. Support from families, friends, and communities is important in helping people deal with difficult situations and maintaining a sense of mastery over life circumstances. Important to health is receiving informal support from perhaps peers, families, community members, formal support from professionals, different institutions or different agencies, as well as societal support in terms of attitudes, beliefs, and values. Social norms or perceived social norms can impact various behaviors such as smoking, drug use, or even sexual behaviors. Studies show that higher levels of condom, social norms, and positive attitudes towards safer sex are associated with condom use. Another determinant of health is education. Education that's meaningful, relevant, equips people with knowledge and skills for daily living, enables them to participate in their community, and increases opportunities for employment. Education is closely tied with socioeconomic status, and effective education for children and lifelong learning for adults are key contributors to health and prosperity for individuals and for the country. So I want you to think about how expensive post-secondary education is. Many people need to work and go to school at the same time. I'm sure many of you can relate. So think about our homeless population of youth or street-involved youth. Many of those youth end up dropping out of high school, which of course then they cannot get into university. But this limits their ability to find work, and it limits them to low-paying work. Furthermore, they miss out on important life skills, information that they would learn in the school setting. Evidence from the second report on the health of Canadians shows that Canadians with low literacy skills are more likely to be unemployed and poor, to suffer poor health, and to die earlier than Canadians with high levels of literacy. People with higher levels of education have better access to healthy physical environments and are better able to prepare their children for school than people with low levels of education. They also tend to smoke less, to be more physically active, and to have access to healthier types of foods. In the 1996-97 National Population Health Survey, only 19% of respondents with less than a high school education rated their health as excellent, compared with 30% of university graduates. Another important determinant of health is working environments. Meaningful employment, economic stability, and a healthy work environment are all associated with good health. People who have more control over their work circumstances and fewer stress-related demands of the job are healthier and often live longer than those in more stressful or riskier work and activities. Evidence from the second report on the health of Canadians showed that employment has a significant effect on a person's physical, mental, social health. Paid work provides not only money, but it also provides a sense of identity and purpose, social contacts, and opportunities for personal growth. Conditions at work, both physical and psychosocial, can have a profound effect on people's health and emotional well-being. So an example of that would be currently right now working on the COVID response. There have been many of my colleagues, a lot of them nurses, but some of them in occupational health or speech and language pathology that are experiencing a lot of stress from being redeployed and working the front lines of COVID testing. And the stress has actually caused a lot of people to end up going on sick leave. So something that many employers are working on these days is trying to promote some kind of a work-life balance and offering on-site exercise facilities or programs, or even offering flexible child-friendly environment where there's perhaps childcare on site. So, once again, thinking back to some of, an example in the previous slide where I talked about street-involved youth or homeless youth, those youth are at risk for being involved in sex work. In a Canadian study, females and males reported sex work as their main source of income, placing them at risk for sexually transmitted and bloodborne infections, pregnancy, and physical abuse. Physical environments are another important determinant of health. At certain levels of exposure, contaminants in our air, water, food, and soil can cause a variety of adverse health effects, including cancer, birth defects, respiratory illness, and gastrointestinal ailments. So an example of physical environments is some of the houses built in the 60s and early 70s have asbestos in them. And that is associated with serious lung conditions such as asbestosis or cancer of the lungs. In the built environment, factors related to housing, indoor air quality, and the design of communities and transportation systems can all have a significant influence on our physical and psychological well-being. So for example, when we see that there's communities with, really nice bike paths, a lot of green space, playgrounds, those tend to be communities where there are healthier residents. Evidence from the second report on the health of Canadians indicates the prevalence of childhood asthma, a respiratory disease that's highly sensitive to airborne contaminants, has increased sharply over the past two decades, especially amongst the 0 to 5 age group. It was estimated that around 13% of boys and 11% of girls aged 0 to 19 suffered from asthma in 1996, 1997. Children and outdoor workers may be especially vulnerable to the health effects of the reduced ozone layer. Excessive exposure to UVB radiation can cause sunburn, skin cancer, depression of the immune system, and an increased risk of developing cataracts. Air pollution, including exposure to secondhand tobacco smoke, also has a significant impact on health. Personal health practices and coping skills refer to those actions by which people can prevent diseases and promote self-care, cope with challenges, and develop self-reliance, solve problems, and make choices that enhance health. Definitions of lifestyle include not only individual choices, but also the influence of social, economic, and environmental factors on the decisions people make about their health. There's a growing recognition that personal life choices are greatly influenced by the socioeconomic environments in which people live, learn, work, and play. In Canada, smoking is estimated to be responsible for at least 1/4 of all deaths for adults between the ages of 35 and 84. Multiple risk-taking behaviors, including the hazardous combinations of alcohol, drug use, and driving, and alcohol, drug use, and unsafe sex, remain particularly high among young people, especially young men. Also, diet and in general and the consumption of fat in particular are linked to some of the major causes of death, including cancer and coronary heart disease. And of course, the use of contraception and condom use are also important in terms of preventing unplanned pregnancy and sexually transmitted and bloodborne infections. Healthy childhood development is another determinant of health. Positive prenatal and early childhood experiences have a significant effect on subsequent health. And this is why there is a large focus on the early years, children ages 0 to 5, in terms of health promotion. This determinant underscores the importance of healthy pregnancies, including the use of folic acid for the prevention of birth defects, the continuity of prenatal, antenatal, and postnatal care, the importance of vaccinations, and the importance of limiting stress or toxic stress on children. Biology and genetics is another determinant of health. Recent research in the biological sciences has shed new light on the physiological makeup as an important health determinant. So, for example, some research indicates that some HPV or human papillomavirus-related cancers are higher in certain races and in ethnicities. In terms of puberty, it usually starts between the ages of 8 and 13 for girls and 9 and 14 for boys. When puberty starts for children may be and is likely genetic. Race can also impact puberty. Some research suggests that on average, people who are Black may start puberty a year earlier than people who are white. And risk-taking is also thought to be biological. A teen's brain is wired for risk-taking behavior, and some people in general tend to be risk-takers. Risk-taking behavior such as unprotected sex or sex with multiple partners can place a person at risk for sexually transmitted and bloodborne infections or unintended pregnancies. Health services is another important determinant of health. There's a relationship between the availability of preventive and primary care services and improved health. So, for example, well baby and immunization clinics, education programs, etc. It's important that health services are accessible, collaborative and participatory, appropriate and affordable. It's also important that we meet our clients or patients where they're at. So harm reduction is a strategy targeted at groups or individuals that endeavors to reduce the harms related to certain behaviors. Example of harm reduction strategies would include offering better access to clean needles or drug equipment via needle exchange programs or safer consumption sites. The harm reduction model acknowledges that abstinence from all drugs is not realistic for all people, and therefore, although drug use isn't condoned, it's seen as essential to implement risk reduction strategies to reduce harmful outcomes related to drug use. It's important that we have access to universal health care, and that's, Canada prides itself on that. However, many low and moderate income Canadians do not have access or have limited access to health services such as eye care, dentistry, mental health counseling, and prescription drugs. Gender and sex are other determinants of health. Gender refers to social and cultural expectations of roles and presentation. For most people, their gender matches the sex they were assigned at birth. Others identify as being transgender or gender diverse. Sex refers to categories, male, female, to which people are typically assigned at birth and may appear on proof of identity documents unless a person has their documentation changed. Gender is an important determinant of health for many reasons. Research demonstrates that people who identify as a gender minority have many unmet health needs and have a reduced likelihood of accessing routine, emergency, and preventive health care services. This happens when people feel afraid to come to health care because of discrimination, whether that's real or perceived. Gender is also important because gender inequality leads to health risks for women and girls globally. Sex is an important determinant of health as well. Males and females suffer from different diseases at different ages. Females tend to have higher rates of sexually transmitted and blood-borne infections compared to males, and the possible reason is the anatomy of females may make them more prone to infections. So for example, females have shorter urethras, or females typically tend to get tested more often than males, and that's why we may see that there's higher rates in females. Culture is the customs and traditions and the beliefs of the family and community, all of which can impact health. So, for example, when parenting children, our attitudes, beliefs, and values will impact the health of our children. Some people or groups face additional health risks due to a socioeconomic environment, which is largely determined by dominant cultural values that contribute to the perpetuation of conditions such as marginalization, stigmatization, loss or devaluation of language and culture, and lack of access to culturally appropriate healthcare and services. And this is why there's evidence to show that Indigenous people are at risk for poor health compared to the Canadian population as a whole. And this is because of years of marginalization and stigmatization. The prevalence of major chronic diseases, including diabetes, heart problems, cancer, hypertension, arthritis, is all significantly higher in Indigenous communities and appears to be increasing. Additionally, Indigenous people have higher rates of suicide. Before I move on to the next part of the population health promotion model, I wanted to share this slide. It really speaks nicely to the determinants of health. So on the left are the traditional 10 tips for better health, and on the right are the social determinants, 10 tips for better health. So what you can do is just press pause on the video so that you can take a read of the traditional 10 tips and the social determinants 10 tips. So next part of the population health promotion model is how we can improve health. So on the cube, you can see that there are 5 health promotion strategies, and this is influenced by the Ottawa Charter for Health Promotion. So the 5 strategies are building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. One health promotion strategy is building healthy public policy. Healthy public policy should ensure that policy is developed by all sectors, and it contributes to health promoting conditions such as healthier choices of goods and services. Some policies include work safety standards, housing standards, child care funding, syphilis and HIV testing during pregnancy and blood screening, as well as policies regarding, where you can smoke, if you can smoke in a public place or not a public place. Now we can see in terms of COVID that we have policy regarding facial masks and where we need to be wearing them. Another health promotion strategy is creating supportive environments. So creating supportive physical, social, economic, cultural, and spiritual environments are all important. A supportive physical environment could be a work environment that has an on-site gym to promote working out. It could also mean having an on-site daycare to promote breastfeeding or chest feeding. Thinking about the communities in which we live, a supportive physical environment might mean ample green space for outdoor sports, paths for bike riding, or paths that enable children to walk to school every day, as well as well-lit roads to enhance safety. A third health promotion strategy is strengthening community action. Strengthening community action so that communities have the capacity to set priorities and make decisions on issues that affect their health. An example of this is several schools have implemented school health committees that include students, parents, teachers, a principal, and other community members. These communities identify health issues and concerns and then come up with creative ways to address those issues. A fourth health promotion strategy is developing personal skills. And this is to enable people to have the knowledge and skills to meet life challenges and contribute to society. So a way to develop personal skills would include offering health education opportunities. It also could mean offering professional continuing education opportunities. So an example of this is the Sexual and Reproductive Health Program for which I work for Alberta Health Services in Calgary. Our team offers education programs to different types of community groups. For example, we offer capacity building workshops for teachers related to the topic of sexual health so that they can then effectively teach the sexuality curriculum to their students. We also offer workshops to parents on how to talk to their children about sexual health, and we offer education sessions to youth in schools and in the community. Right now, because of COVID, obviously that looks a little bit different. In some cases, we are still allowed to go and do face-to-face presentations, but in other cases, we're just more so providing support to teachers or offering other methods of education. All of these programs aim at the development of personal skills. Finally, reorienting health services is another important health promotion strategy. And this is done to create systems which focus on the needs of the whole person and invite a true partnership among providers and users of the services. Telehealth is an important way that we have reoriented health services. It is the use of information and communication technology to deliver health services, expertise, and information over distance. Telephone, email, and the internet are means of providing telehealth services to those seeking information on various topics. Especially now during COVID, there are some doctor's offices that are actually offering telehealth as a first step to meeting the health needs of their clients. And then if those clients actually have to come in to their practices, then they invite them in if they absolutely have to. And, of course, this is a way of improving access for people to services, but it's also a way of preventing the spread of communicable disease during a time of this pandemic. So the next part of the population health promotion model is the level of action. So who do we promote health with? And there can be health promotion on multiple levels: individual, family, community, sector or system, or society. Finally, the last part of the model is the importance of evidence-based decision-making. This model illustrates the need for evidence-based decision-making to underpin the development of population health promotion activities. Evidence-based decisions are required to ensure that policies and programs focus on the right issues, take effective action, and produce sound results. When assembling the evidence required, 3 sources should be consulted, such as number 1, research studies that have systematically studied health issues, the underlying factors, the interventions and their impact, both intended and unintended impact. Experiential knowledge that has been gained through practice and synthesized in ways that can guide practice and policy making. And evaluation studies, so formative and summative types of studies of policies, programs, and projects. These sources provide evidence base on examination of past activities. In addition, trends can be analyzed to identify emerging issues, and visioning can be done to create preferred scenarios for the future. Evidence-based decision-making is thus an art and a science where collective wisdom and vision, along with empirically driven knowledge, play worthwhile roles. Thanks for listening. If you would like more information, please refer to the article or document called Population Health Promotion, an integrated model of population health and health promotion by Hamilton and Batty.